Welcome to this edition of Healthy Living. I'm your host, Tim Kelly. Very important topic to talk about today, very timely topic to talk about today. We're going to be covering sort of the flu season of late 2019, early 2020, as well as the coronavirus, two topics that are definitely in the news headlines as of late. And to talk about this great topic, coming from the Western Tidewater Health District, we have Dr. Nancy Welch, who's the acting director, and Amal Patel, who is the district epidemiologist. Thank you both for being with us today.
Thank you.
So let's kick it off. And again, we kind of have two topics that sort of intermingle, but sort of don't. But let's tackle the flu first. Where are we right now in the season, if you will? And, you know, if people who have received a vaccination before or maybe haven't gotten one yet, what words of encouragement would you offer to them who maybe more so probably for the people who have not had that vaccination as of yet, with where we are again in the season?
Would you like? Okay, I'll start off. So we track the flu season using some surveillance data we receive from hospitals and urgent cares. Using that data right now, we're at widespread flu status in the state of Virginia, and it's been for 8 weeks now.
Right.
So it's out there. The composition of the strain circulating is starting to change. It was B earlier in the season. Now it's switching more over to A, which is a better match for the vaccine that is available. And a word of encouragement for people who haven't gotten the vaccine is that it's a much better match for the circulating strain right now. So it's not too late to get it. It takes about 2 weeks for it to come to full effectiveness.
Now, when we talk about the vaccine, again, it's not a preventative. It's really going to help you lessen symptoms in the event that you would develop the flu or come down with the flu. Is that correct? Are we clear about that?
Well, in some cases it is
Sometimes
a
it
preventive.
is, okay.
When if you're asking for 100% preventive, no.
Right.
Nothing is 100% preventive. But again, if you're looking for improved odds, not only improved odds to keep you from getting the flu vaccine,
Right.
but also even if you get the flu, if you've had the flu vaccine, we know that you will have dramatically reduce symptoms, and studies have also shown that you have a 40% less risk of requiring hospitalization or having complications. So it is both preventive and also certainly lessens the symptoms.
And I know we've talked about this before, but I wanted to kind of go over this again. The fact that you hear people say, well, I've gotten the vaccine in the years past, and I got the flu, so that caused it. How would we explain that again situationally for the kind of the broad approach to that?
Right. Well, the flu is a killed vaccine. It is incapable of giving you the disease. It cannot give you the disease. It is true, however, that it takes about 2 weeks to develop your protection, your immunity from the flu vaccine.
Right.
So if you've already been exposed, you already have the virus in your system, then you may still get it,
Right.
but you're not going to be as sick. And also, as we just discussed, it's not 100% effective.
Right.
Certainly better than zero.
Correct.
So it definitely improves your odds, but it's not 100% effective.
And one thing about influenza, you develop symptoms from 1 to 3 days after you've been exposed to it. So if you're exposed to it like 2 days before you get the vaccine
Right.
hasn't had enough time for you
Correct.
to develop immunity.
Things are kind of lining up with,
Yeah.
again, situationally there. But outside of the vaccine, what is the basic things that people need to be doing at this time of year to kind of stay as healthy as possible and avoid, you know, again, we might be around people that have been exposed or that maybe to a certain extent have symptoms or whatever. What's the best thing that people could be doing now, in addition to the vaccine itself?
The number one public health message we have, wash your hands. Wash your hands after you sneeze or cough, after you walk through a room and touch items, because one thing you don't know you do unless you sit there, videotape yourself and watch you doing it is how many times you'll touch your mouth, your eyes, your nose,
Right.
and that's how you'll get in contact with the virus. Yes, you can get it from respiratory droplets from someone who's sick, who's coughing or sneezing near you, but it's just as common, like I'm touching this
Right.
and then I start touching my eyes or nose or
Right.
mouth, or I eat, it just, the virus needs a pathway into the body, and sometimes we do it without thinking about it. So that's why we always say wash your hands. I know
Right.
it's like verbatim, we keep
Kindergarten
saying that.
101, right?
That's right. That's right.
And another thing, if you're in a facility where there's a lot of people walking through, or,
Yes.
like a school, wash commonly touched surfaces very often throughout the day.
Right.
Basically, you're just disinfecting those surfaces to prevent transmission. Social distancing, if you're, in a line and you see the person in front of you might be kind of coughing or whatever, maybe just take a few steps back and just try to increase the distance you have between that person.
The effectiveness of masks. We see some people that wear them, and I guess maybe depending upon their own personal health situation, they might be more at risk for something versus someone else. Helpful, not helpful in the context of what you're talking? I mean, obviously, if you have a mask on, it's harder to touch your mouth and your face and get it in there, but just curious on feedback on that particular item.
Defer to you.
Well, you present a very practical improvement with the mask. You're not touching,
Right.
and that certainly is extremely
Sure.
important. It also, more so than anything else, if you happen to have the virus, it's going to prevent you from spreading it, which is why you often will see hospitals will say, well, if there are visitors have to wear the mask.
Right.
And they're doing that so that they can prevent the onslaught or the incoming
Right.
of any kind of a virus from visitors. So
Got it.
it's really the way that we use, because they're not respiratory type apparatus,
Correct.
which are used in real isolation and prevention type endeavors. But this will prevent, it does cut down on the spread of it, so that even we don't want someone, if they're coughing, to cover it up with a mask and say walk in to visit someone in the hospital,
Right.
or for that matter to go to work.
Mm-hmm.
When they have done studies on flu, they've found that about 40% of people say they contracted it from people at work who came to work. Well,
Right.
I hate to disillusion anyone, including myself, but well, somebody can do our job.
That's right. That's
We're
right.
not, it's not that we have to be there.
Right.
We are dispensable. I hate to say that. All of us are.
Yeah.
And it is far better if you're sick to stay home.
Mm-hmm.
And of course, nowadays there are many who can telecommute,
Correct.
which can even save those sick days
Right.
if possible. But stay home if you are sick, because there's nothing bravado about it. You're actually jeopardizing
Yes.
the people in your workforce. So it's not a good thing to do that. And the other thing that I would say is if you have symptoms, so you need to seek medical care, maybe you're having difficulty breathing or something of that nature, you should contact the physician first. If you're a patient in that physician's waiting room, you don't want to be exposed
Right.
to something else. So contact the physician. They may ask you to wear a mask. They may have another door
Right.
where you can enter. Practices vary on how they handle that, and the same with the emergency room. But it is certainly not only in your best interest, but on everyone else's best interest in the community, for you to contact them first. That is extremely important to do that. A lot of times, the simple measures, like Amal has mentioned,
Right.
Your grandmother told you that, right? And so you don't give it enough credibility
Right.
because it sounds far too simple in today's days of tech and more
Right.
sophisticated vaccines. But the truth is it works.
Mm-hmm.
And so we need to give it proper credibility.
Keep it simple in a sense, in that respect. Now, Amal, you mentioned earlier the amount of cases that we're seeing in Virginia, especially. Is that different than maybe perhaps we've seen in recent years around this time of year, or how is that varied?
This is typically when we do see our widespread status. Again, this season has been flip-flop because the B came out first when typically it's the A, and right now we'd actually be seeing an increase in B.
Got it.
But we're seeing the reverse.
Right.
And typically it can go, through February. March is usually when, we start to slow down, and so we're right in the thick of it. So.
Now, you mentioned the phrase, and that leads into the next topic, I guess, the thick of it. When we talk about the coronavirus, it's happening at the same time that we're talking about the flu and everything here. In a basic sense, what are we talking about when we hear the phrase or the term coronavirus? I know it's what kind of originated, so to speak, in the Hunan province of China,
Yeah.
as far as kind of where that was the epicenter. And we see a lot of activity, a lot of talk about that. But obviously, there's been talk about it coming to the United States and certainly other countries that are closer to China. But what are we talking about when we talk about the coronavirus? As far as what are we dealing with there?
So the coronavirus, there's different types. The four most common types of coronavirus are the ones that typically cause just those mild sniffles or what we would refer to the common cold. We have three other coronaviruses. I'm sure most everyone is aware of them. SARS, MERS, happened previously, and now we have this new novel coronavirus that's causing illness, similar symptoms to flu, but It also can progress to pneumonia, kidney failure, and possibly death. Right now, we do not have any person-to-person transmission in the United States as of right now. All 5 cases we have in the United States are from travelers that were in China, traveled to the United States, and became symptomatic here and sought medical care. That's not to say those are the only ones. There's others being tested as well. But currently, the person-to-person transmission, we're seeing the brunt of it in China where it originated.
Now, vaccine-wise, is there anything for this at this point in time? I think we discussed off camera, but I see you shaking your head no. So, kind of where are we looking at it from that perspective?
Yeah, there is no vaccine for the coronavirus, any of those coronavirus at this time. The good news is that actually SARS, you may remember SARS from the early 2000s and MERS around 2014 or so. And so this is sort of like a repeat of SARS. So we have some experience, and I think that's important for the public to know. So the expediency with which preventive measures have taken place, say at airports, for example. CDC has a unit that only deals with preventing the influx of communicable diseases by way of the airports. And so they, right now, if you've come by any way of your travels through the Wuhan or any of the areas in China, it's not just in that location.
Correct.
That is the epicenter. But if you've come from any of those places, you will only be able to land in 5 different places. It doesn't mean it was what the original plans were. You will be diverted to only be able to land in 1 of 5 places, because at those places CDC is there and they will do a screening. So they've been able to put that into place much quicker because we've had the experience of SARS. So they're using that experience to a major protection to prevent the influx into the country. Certainly when we had SARS, Canada as one example, experienced major problems where their healthcare workers were developing the disease, and it had major economic impact, as you can well imagine it. And so not only from a health perspective, but we're looking at it from an economic perspective for our entire country. It's good that they are now able to mobilize all of these efforts so soon and use what we've learned from the SARS.
And just to add to that, right now travel to China, CDC has put level 3, basically mean non-essential travel to China is discouraged strongly. And that's another lesson learned from SARS is, if you are traveling just for fun, just cancel those plans. And
Have fun someplace else.
That's true, and there's plenty of opportunity for that, especially right here in Suffolk, a great place to be. So,
there you go.
little advertisement there. But is one type of person, be it age, be it health condition, where more susceptible that we're learning about when it comes to what the coronavirus can do or affect people? Or you mentioned its symptoms are similar to what we talk about with the flu, so we kind of deal with the same potential pool there, even though I guess everybody's potentially affected or a candidate, so to speak.
Yeah. Again, it's a new coronavirus, so you can only go on what you know.
Correct.
So, I mean, a lot of this information is still forthcoming. Like with flu, we know when a symptomatic or a person who has the flu, when they are contagious. We still don't know that with this novel coronavirus.
Correct.
One of the things we do know is symptoms usually start after you're exposed to this coronavirus from 2 to 14 days. We don't know if you're contagious during that time or when the contagious period starts. So again, a lot of the information is still coming forth, and a lot more study has to be done with this virus and who's gotten sick and what the end results have been.
And you mentioned already, though, that really the people that have had it or in the United States are people that traveled in with it. And it's not the person-to-person exposure or the contact.
As of right now.
As of right now, correct. I know everything's sort of evolving every day. The headlines are reading this or reading that, and everybody's worried about their own backyard, but certainly we're looking at the global picture totally. We're evaluating kind of how things are going, and I guess learning as we go through it by what other countries are experiencing, how they're handling it, pluses, minuses, things like that, to adapt to our strategy, like you talked about right here at home with the CDC. So.
Right. And again, I think it is, I can't say it enough times, that the general preventive measures for flu and coronavirus
Right.
are the same.
Right.
It's the wash your hands, the prevention. The benefit is that we have another tool also for flu, and that's the vaccine. The other thing that I think is so important to emphasize is that this is not the first time around with the coronavirus.
Correct.
And so we utilize the experts from CDC immensely. When we get a potential investigation case that needs lab testing, we're conferring with the experts, and the
Right.
people in Richmond are talking with people from CDC on a weekly basis and more often than that.
Right.
So we are building on some experience. It's not all totally unknown, the specifics, because it's a novel coronavirus, certainly, as Amal has mentioned, but we're using that experience, and that's, I think, incredibly important. Now, will we see more cases? Yes. Will there be a likelihood that we're going to see transmission person to person in the United States? Yes. Cannot deny that one iota. But in the midst of that occurring, I think that there's a very good chance that it's going to be as minimal
Right.
as possible
Right.
because of that experience. And also in the midst of it, I don't want it to distract from the flu.
Correct. Right. Yeah. And that's the thing, that both these things are kind of occurring at the same time.
Right.
And as we discussed before as well, the fact there have been more, the flu deaths are at a much higher rate as far as what we're dealing with
Right.
right now, exposure cases, everything with that. But we don't want to, like you said, don't want to forget about the one that's perhaps more prevalent at this
Right.
stage of the game than the
Right.
coronavirus. And I'm sure there may be people that think, well, I've come down with these symptoms, I've got well, no, you more
have the
likely to
flu.
have the flu. But again, that's why you stay in contact with your doctor's office, and you talked
Right.
about the fact if you think you have the symptoms, correct me if I'm wrong, contact your doctor's office before you just go traipse it in
Absolutely.
there
Correct,
to
yes.
make sure that you're not exposing other people to it, as well as protecting yourself from other things that may be in the office, so to speak, that could
Absolutely.
exacerbate your symptoms, correct?
Absolutely.
Right. And wash the
We could
hands.
switch positions.
Well, we talked so many times over the years that I've learned a lot. So I'm just giving you back what you've given me, in a good sense, if you know what I'm saying. So, but see, I do listen every now and then, pick up a few things, little tidbits here and there. So as we close the segment, I want to give you both an opportunity just to sort of address the fact of really focusing back on the flu for just a minute, what people need to be thinking about, and really for the coronavirus as well. In that sense, is the basic tips and advice you can give people that maybe have not gotten the vaccine, even if they have. Again, it's simply, again, get back to washing the hands and being cognizant of kind of what you're doing and what you're interacting with. But just some advice the two of you would offer, or suggestions, I
And
should
I'm
say.
going to let Amal take the lead on
Great,
this
okay.
because I want him, I know he has specific information locally
Right.
where people can call
Great.
If they have any questions. And he is certainly the person who is engaged with schools, with
Right.
physicians, with everyone in the community.
Again, reiterate, just make sure, if you haven't gotten the flu shot, it's not too late.
Right.
Some of the information that you're going to put with this video has some good information on influenza resources. Again, the health department's a good resource. You can call for information directly. And just, wash your hands.
Yeah.
Just keep washing your hands. And, one thing in the eastern region we're seeing here in Virginia is a pretty, they've come up with the intensity scale of influenza reports like statewide, and Eastern is it's at the high level, so it's at high intensity. So again, it's out there. It's probably stronger here and in Central Virginia. So again, not too late to get the flu vaccine.
And this is going to sound really so simple, and it may be coming from a pediatrician. I just
Sure.
really am obliged to do this.
Right.
But to be perfectly honest, the children know how to wash their hands better than adults.
Yes.
And they're taught little mnemonics, sing happy
Right,
birthday
right.
or whatever, and they're taught to go between their fingers. If you watch someone wash their hands, an adult, that's it.
If you're lucky, you get that much sometimes, right?
Right. So watch your kids.
Yeah, yeah.
And the other interesting thing, if you watch it, the kids have bought into the cough and sneeze
Correct, yes.
in your shoulder.
Yeah.
Adults haven't yet. So in this respect, I'm saying learn from your kids.
Right. Great advice. Great advice. Well, Dr. Welch and Amal, I appreciate you both spending time with us today to talk about these very two important topics. And certainly, as Amal mentioned, contact Health Department has a lot of great information. Western Tidewater District Health District leading the way as far as with that. It's certainly on the local level, and we'll have all those contact information points on the screen
Super.
that people can follow. Again, certainly reach out to your doctor's office in the event that you think you may have the symptoms. Again, as we mentioned, to make sure that when you go, you're going in the way they would like you to do, whether it's wearing a mask or perhaps a different entrance as we discussed. So again, just staying safe and keeping your fellow friends and neighbors safe as well as best we can throughout flu season, and certainly as the coronavirus information continues to come out on that particular topic as well.
Thank you
Again,
very
thank
much.
you for
Thank you.
your time today. Appreciate that. That would do it for this edition of Healthy Living. I'm your host, Tim Kelly. We'll see you next time.